Hi guys, this is Malak from Ontario School of Osteopathy and Alternative Medicine. So I'm going to be teaching a technique today called Counterstrain technique. So what happens is that some of the students, they're a little bit confused with this technique, comparing it to trigger points. The reason is that we use tender points when we're performing counterstrain techniques, and everyone thinks that they're very similar or they're the same thing as a trigger point. There's a little bit of difference here. For trigger points that we have, normally the pain will radiate. So when you compress the point, it's going to radiate to another area. But for tender points, there's no radiation. There's a couple of key things you want to remember here for the technique. So the key points are going to be the following. The first thing is that this is a passive technique. So when we say passive, that means that the client is not going to be doing anything. You as the therapist is going to be performing all the movements for the client. And then the other thing we need to keep in mind is that this technique is going to be an indirect technique. When we say the word indirect, it kind of sounds opposite to what we should be thinking. Indirect means we go and we take the muscle and we shorten it. So we bring the muscle into an approximation type of position. So for instance, if we're talking about the biceps, we're going to be bringing the origin and the insertion closer to each other. So we're kind of contracting the muscle, but as I mentioned, it's going to be done passively, so the client is not doing the contraction. You as the therapist are going to be performing the movement for them. Then the last thing that we need to do, we need to make sure that we find the correct tender points, and we compress the tender points to make sure that the pain scale can be determined by the client. So we're looking for a very high pain scale, maybe something like around a 7 or a 10. So we make sure that this is the most painful point for the client. And then from there, what we're going to do, we're going to we're going to keep our finger there on the tender points, but then after, we're just going to decrease the compression that we have applied, and then bring the muscle into ease position. So it's going to be the position of comfort where the client has no more pain. And then we're going to do the following thing, which is we're going to hold that ease position for 90 seconds. So we need to make sure that we keep the point for 90 seconds and we don't do it for anything less, because we want to make sure the first time that we perform the technique, the client has a full response to it, where after the technique is done, the pain scale, which is, let's say for example 10, goes down by 70% minimum. Okay? So minimum has to go down by 70%. So if it starts off with a 10, the client should have a response of 3 pain scale, or maybe a 2, or maybe nothing at all. Okay? Then the other thing that we need to remember is once we finish the technique, when we want to bring the client's arm or leg or the back, wherever it is that we're performing the technique, back to the neutral position, the client should not have any movement again. Completely relax and completely in the hands of the therapist, where they're doing all the movements and bringing the client's arm or leg back to the neutral position. So these are the main things that we need to keep in mind. And then for you guys to get a better idea of how to perform it on the client, I'm going to be performing it on a patient so you guys can get a clearer idea. Okay guys, so now we're going to be demonstrating the counterstrain technique. So I'm going to be working on the posterior tender points that we have. So I'm just going to find some of the tender points here. Is there any? So we're going to just find the spine and then the medial border of the scapula as well. Any pain here?
Yeah.
Can you scale the pain?
5.
5? Okay, so we're just going to look for another point to see if it's more painful. Any pain here?
Yeah.
How's the pain scale?
4.
4, okay. So we're going to try to find the most painful one. Pain here?
Yes.
What's the pain scale?
9, 10.
9, 10. Okay, so this is going to be the point. So as I said, we're going to, now that we have found the point, we're just going to keep our finger there so we can be able to reassess the point after. And then I'm just going to switch hands. So now we're going to completely make sure that the client's muscle is relaxed. Please relax. And then we're going to bring the muscle into an ease movement, and we're going to hold this for 90 seconds. Okay, making sure that the client is not doing any sort of action and the muscle is completely being controlled by the therapist's hand. So this is going to be more on the rhomboids area. How are you feeling?
That's good.
You alright? So now what we're going to do, we're going to slowly bring the arm back down, okay, without the client doing anything, for us to do all the movements. And this is the point that we originally had palpated. So we're going to compress the point again. And how's the pain now? Can you scale the pain?
Yeah.
What's the scale now?
2, 3.
2, 3. So it just works that simple. We need the pain to at least be reduced, the tender point to be reduced by 70%, okay?